Hi, my name is Natalie Rail, and for my site visit project, I visited my hometown clinic that I've been going to, which is the Lina Health Woodbury Clinic. And it has a picture of it and then the address down below. The history and purpose of a clinic setting is the purpose is providing primary and specialized services to patients. And then the history of it is that the first clinic was opened in Pittsburgh, Pennsylvania in 1910. And then after that, the next clinic to open was in New York City in the year 1913. And then when clinics started spreading more was in 1916 when they started moving to other big cities such as Boston or Philadelphia. The types of patients that are served in clinics are every person, like anyone from infant to the elderly. They have family practice doctors that see pediatrics, you have people who have adolescents and adults, and then late adult and elderly, so all types of patients are served in this type of care setting. Types of cares offered in a clinic include family practice, nursing care, urgent care, pharmacology, like picking up over-the-counter drugs or prescription drugs, and then some specialties. And some common specialties that are offered in a clinic include mental health, an OBGYN, an ears, nose, and throat specialist, and then rehabilitation. Types of professionals that you see at this type of setting include a registered nurse, and in order to become a registered nurse, a person would need to obtain a bachelor's degree in science of nursing, and then after they complete that program, they would need to pass the National Council Licensure Examination, which is more commonly known as the NCLEX. And you also see physician assistants, and in order to become a physician assistant, you need a bachelor's degree, and not all the time, but typically people who want to pursue being a physician assistant have a bachelor's degree in some sort of science. And then after graduating from that, they would need to get a master's degree in a certified physician assistant program. And then when they are done, they need to pass the PANCE exam, which is the Physician Assistant's National Certifying Examination. Some other common professionals that you see in a clinical setting include a certified nurse midwife, a doctor of nurse practice, and then a physician. A midwife needs to obtain a bachelor's of science of nursing and then passing the NCLEX similar to a registered nurse, but then they would also go on to complete a nurse midwifery program and then pass the certified nurse midwifery exam. And then to become a nurse practitioner, they would again follow that same path of becoming a registered nurse, of getting a bachelor's degree in science of nursing and then passing the NCLEX. Then they would have to go back to school to get their master's of science in nursing and then complete the doctorate of nursing practice program. And then in order to become a physician, they will need to attend and graduate med school and then postgraduate training such as internships or residencies, and then they would need to pass the national licensing examination. Accessibility of services is they typically happen by appointment, especially in a clinical setting. Some clinics, such as the clinic that I visited, have scheduling available 24/7, but that's not very common. And then online care is also available and becoming more popular ever since the COVID pandemic. And walk-ins are also available, but not as reliable as making an appointment. Typical administrative structure for a clinic includes as you walk in the door, you see the reception area of everyone who checks you in, and then the waiting area. Then you see the core staff of the nurses and then the physicians, and then the next level up would be the administration supervisors and the care coordinators. And then after that would be the department heads for each specialty, and then the president, and then the board of directors. In the cost and reimbursement structure, it's a typically fee-for-service structure where you would get a service done and then you get billed by the provider's rates, and then that would go to your insurance, and then whatever they didn't cover, you would have to pay the remaining stipend. And then I included some common healthcare insurances that are covered by most clinical settings, which include Allina Health, Blue Cross Blue Shield, Health Partners, Cigna, and then United Healthcare. Licensure requirements for a clinical setting include the state medical licensure, the National Provider Identification Number, the Drug Enforcement Administration, and then medical credentialing, and then staffing. So these are just all requirements that a checklist of each clinic has to go through to make sure that they are operating within safe guidelines. Current issues with a clinical setting contain but are not limited to limited patient engagement, which includes patients not wanting to come in for reasons such as financial reasons, accessibility, and then communication issues such as just a gap of communication between patient and provider, and then finance and billing issues. If a patient gets misbilled for a service, and then it's a lot of back and forth. And then patient record management. More clinics still have paper tracks of patient records, while hospitals only have electronic, so it's hard to manage both electronic and paper. So that's a common issue. Then administrative unorganization. It is not as organized as a hospital setting, so that can be a good issue. And then scheduling, because there is only limited staff in the area. And the two people that I interviewed when I attended the clinic were my doctor and then another nurse practitioner. So my doctor was Danielle Montague, and she is a practicing physician, so she is a medical doctor, has her MD, went to school to be a doctor, went past through med school. And then Christina Rice is actually a nurse practitioner, but she's still a practicing physician. So those are the two people that I interviewed when I went and visited this site. Okay, and then when I reflected after my visit, I noticed that the research was pretty much the same as my visit, so it was like what I was expecting to see, but there was a couple differences that I noticed. And the first one is that my clinic that I visited had the option to schedule appointments 24/7, through calling, or the more common one was through the Allina Health, MyChart, and that was unlike a couple of the clinics that I saw. There was some of them that mentioned it, but the clinic had the option to do it through your account, which was very handy. And then this clinic had a lot more specialized cares than typical clinics. The one that I have highlighted here is Courage Kenny, which is the Allina Health's rehabilitation center. And Woodbury Clinic has a big area for Courage Kenny, so that is one of their main specialized cares that's available, and that's not as typical in other clinics. And then Dr. Montague said that there was a different issue that had been pointed out in my research, and it had to do with scheduling, because Dr. Montague has a bunch of patients, so she talks about that scheduling can be an issue because she sees such a wide range of patients. So if a patient needed to see her right away, she would be booking out for 3 weeks, so that was a big issue that she had noticed. And then a clinic versus a hospital, there were only a couple similarities and more differences. The similarities that I saw were that the services both used health insurance coverage to help patients with financial issues, and then they also had the same types of workers, which included the practicing physicians and the nurses. And the more differences that I noticed is I more saw the clinic as a smaller structure and the hospital as the bigger. So in a clinic, it's more outpatient, and hospitals are more inpatient. While they do have outpatient, that is not what the hospital typically is. So that was one of the big differences. And there's also significantly less staff in a clinic than there is in a hospital. And then you go for a clinic for a lot less severe and fatal issues versus hospitals. You see those more dangerous and more alarming issues. And then pricing, clinic, it depends on the type of services that are being done. So there's less invasive or complicated procedures happening in a clinic, so the pricing is a lot cheaper for what happens in a clinic versus a hospital. And my assessment of my clinic is I believe that they're very valuable in the very big key component to healthcare, and that's because they are more focused on preventative measures, while people who go to clinics regularly can catch things that might turn into bigger issues later, which could help prevent them from having to go to the hospital. So that's why I believe that they're very valuable. And one thing that I could critique about it was accessibility would be difficult without good insurance, as we have noticed throughout the course. Insurance and being able to afford care is a big issue throughout the United States. So that was like one of the big critiques I had of the clinic. And then I believe that it's very high quality because as it is that smaller environment compared to the hospital, it's not as fast paced, which allows all the workers to be more focused on the patient and then having patient-centered care. And those are my sources.